for people who have developmental developmental diseases and are basically isolated and have no social life. We offer them peers, friendships, and hopefully careers. It's been very actually world known, and we've been doing very well, covering over 200 million who have Down syndrome and many other diseases. I also am a full-time volunteer with the School on Wheels. This is something very new, but many people don't know that California holds one of the highest rate of homeless children. Because of COVID, we've now reached up to 90,000. And what we basically do is we tutor these children. We tutor them to make sure that they graduate and they end up in college and they get an education so that one day they would never have to be homeless and they can help themselves. We've caused lots of world leaders. I'd like to say one of them is actually running for office who was once homeless. And it's been very, very important to me lately to be part of School on Wheels. This is just a little bit about some of the organizations I work with.
Thank you so much, Rima. And no doubt we'll explore more of what you've been doing and the work that the organizations you work for have been doing. So fantastic. Thank you so much for that. Barbara, perhaps you can tell us a little bit about yourself and the organization, UN Peace for Women.
Yes, the United Nations Women for Peace. I am honored to be the president. Dame Muna Rouhani Al Nasser, a lady from Jordan, is our chairman, and she is the founder. And her vision was to do something really impactful, to put together an organization, UN Women for Peace, to really spearhead the movement to end violence against women and girls worldwide. So we want to end and prevent the violence, and we're trying to find the vehicles to do so in a very new and innovative way. We are one of the major donors to the United Nations Trust Fund to End Violence Against Women and Girls, and we have positioned ourselves to be in a very, very important advocacy and activism role in order to put this situation that confronts women and girls worldwide in front of the eyes of civil society, corporations, and governmental institutions. And all of us have to participate in changing this enormous problem that faces humanity at the moment.
Thank you very much, Barbara. Thank you. So Dima, can we hear a little bit about your organization, please, and what you do?
So thank you. I'm also really honored to be part of this amazing panel. And I'm today representing the Global Compact Network for Lebanon. This is a network that is affiliated with the UN in New York. And our mission is to work with the private sector and with businesses on social and environmental and humanitarian projects. So we founded the network in 2015. It's been 5 years in operation, but we grew to substantially to 250 members in the span of 5 years. And this is today recognized globally to be one of the best and most innovative networks working on sustainability with the private sector. So very honored to be to be today on this panel in this capacity.
Thank you for that succinct introduction. I'm very excited to hear how you've managed to really collaborate with the private sector, because I think that's key to charitable organizations and helping them to support the work that they're doing. So thank you so much, Dima. I go to Dr. Sosan now. Dr. Sosan, can you tell us a little bit about yourself and the organization?
Thank you, Soraya, and thank you for my esteemed colleagues who are on the panel with us today. As Soraya said, my name is Dr. Sosan Al-Maldi. I'm the Director General of Friends of Cancer Patients in United Arab Emirates. Basically, Friends of Cancer Patient, or for short, we call it FOCP. We have been around for the past 20 years. I think this year, in September, will be 21 years since its establishment. And we work across 3 pillars. So we provide cancer patient access to treatment, and also in the access to treatment, also we provide the patient and their family moral and psychological support, The second pillar is we focus on community awareness, and we focus on health literacy for the community because we believe that cancer prevention and early detection is a very key to, of course, survival. And also in United Arab Emirates, the leadership here really focuses on human capital. So we try to educate the community about staying healthy. The third pillar that we work at Friends of Cancer Patient is advocacy. And we don't just do local advocacy as on a national level, but also we do regional through our collaboration, especially with King Hussein. I can see my esteemed colleague Nasreen. And also one of our partners are incidentally our children cancer in Lebanon as well. So we have lots of partners across the region, but also globally. We are a member of many international organizations. And recently, for the past 5 years now, we have been even advocating not on cancer level, but also on non-communicable disease or NCD level, which we believe also is a very important. Of course, our patron and founder is Her Highness Sheikh Jawahar bin Mohammed Al Qasimi, the wife of the ruler of Sharjah. And she has been a leader in philanthropy because we're talking about women in philanthropy. So she actually has been a leader in philanthropy for the past 30 years. I am honored to be part of this panel and also be part of FOCP family. I've been there for 18 years, but who's counting? And thank you very much, Soraya. Back to you.
You're very welcome. Thank you. That was very inspiring. It was only short introductions. I can't wait to hear more about that amazing work that you're doing there. So I might just speak to Nasreen, since you're quite connected to Dr. Salson. You've done some work together. Nasreen, can you tell us a little bit more about the organization you work for?
Yeah, thank you, Soraya, again, and thank you for Forbes for coordinating this very important session, especially with the all focuses from all around the world on COVID-19 and forgetting about all other causes. It's really important for us to remind people that there's other causes that needs our attention and needs our support as well. So I'm representing the King Hussein Cancer Foundation and Center. We are a non-for-profit, non-governmental organization. We are chaired by a very strong advocate for cancer patients, Her Royal Highness Princess Ghida Talal, who established the foundation and the center 20 years ago. We are providing comprehensive cancer care for 70% of cancer cases in Jordan. Among them, we have refugees and displaced people from Libya, Yemen, Palestine, Syria, and other countries as well. Our mission is to ensure the continuity of the treatment of these patients with specific focus on the underprivileged and displaced patients through fundraising, community mobilization, advocacy, and of course through our partnerships with the regional partners like the Friends of Cancer Association and international partners like St. Jude, MD Anderson, and other medical partners as well. So our main focus and mission is to ensure continuity of treatment of the current 24,000 active patients who are getting their treatment at our center.
Amazing. Thank you so much for that introduction, Nasreen. And I'm looking forward to hearing more about that as well as we go on. I might just take it to Manna. And can you tell us a little bit about what you do, Manna?
Thank you, Soraya. And it's an honor to be on this panel today. We didn't get a chance to say hi to everyone. So hello to all the panelists. So GIFT Global Initiative was founded on the, a basic philosophy, but it's so important it's a wise saying that goes by, give a man a fish and you feed him for a day, and teach him how to fish and you'll feed him for his lifetime. So GIFT was founded on that philosophy. We are very proactive in nature, so we don't sit back until something happens to go out and do humanitarian work. We have programs and initiatives in Asia, Africa, Latin America, and the USA. Most of the initiatives are focused on children, but obviously we end up working with the families because you cannot just work with children. You have to strengthen the family unit so the parents can take care of their own kids and provide them with a safe and secure environment. So GIFT reaches about 10,000 children every year. And we like to divide the programs and initiatives in four, I would say, large goals. Education, we have a medical fund that, we have cases which deal with both mental as well as physical illnesses. We also do solar and water initiative, which is very close to my heart. And then lastly, we have a job creation program, which really focuses on women empowerment. So creating jobs in communities by teaching the women skill sets such as stitching, and then taking those products and selling those on e-commerce portals, and that money goes back into these communities. So that's what we do. We have been around for a couple of years. Personally, I have been doing this for 15 years. So
thank you so much, Manna. Thank you. There's a number of points that you've made that I think are really vital to hear more about. So I'll definitely come back and ask you some questions on that. But for now, what I'd like to do is really go into asking the questions and hearing from all of you. So I might take back the conversation to Rima. And Rima, the first question for you today is, what have the challenges been during COVID? So COVID has put an enormous stress and pressure, not only on individuals, not only on organizations, but in particular, I would imagine charitable organizations, because you rely on the humanitarian and caregiving and people's willingness to collaborate to something that is greater than themselves. But if they're really feeling the pressure, of whether it be financially, physically, or even mentally, will people rise to the occasion and give back? And Rima, I've heard from you about the challenges that you've faced during COVID to really fundraise. So I'd love to hear more about that today.
Yes, thank you for that question. Absolutely, it's a very difficult time. And I actually was announced ambassador before the COVID crisis hit. And when it did, I had said this in an interview previously, is that I was thankful that I was the ambassador now versus someone else, because I felt that I can bring more global awareness. Because of COVID and because of many other reasons that's happening in the Middle East, bringing global awareness is what we need. Of course, everyone's going through a hard time. Everyone. We're all in the same boat. But the word that I'd like to spread today is that if you want more kindness in the world, you have to put it out there. So for us to really help ourselves, we help to help others. And I always rely back to a movie that came out in the year 2000 called Pay It Forward. And, it was just someone who helped 3 people, hoping those 3 people will then help 3 people. And this will start a motion of a wave of kindness that will spread humanitarian work around the world. So I'm hoping to bring that awareness and to let people know that anything helps. And this is the only way that we can bring change.
Okay, so was there any challenge in going about what you were required to do during COVID? I mean, so you're bringing awareness to people, but what were some of the challenges that you faced, and how did you overcome those?
Well, actually, we're facing a lot of challenges. For one, we tried to launch a campaign, for example, for the Children's Cancer Center of Lebanon called the Golden Ribbon Challenge, which only required 1,000 lira of a donation. That's less than $1. Unfortunately, it was not successful. Just to show you how hard it's been for people to donate and for people to have money to be able to even give back that little. And that little is not little to many people. It's been a very big challenge right now to see what other ways we can bring about donation, because this center only survives off donation.
Mm-hmm. Okay, thank you, Rima. I understand that it's a hard time, particularly in Lebanon. I mean, we're aware of the economic and political situation, which is probably a little bit different. But Dima, I might bring you in at this point, because you're also based in Lebanon and you also work for a similar organization. And so I'd like to hear a little bit from you about perhaps the challenges you faced, whether they're similar or different to Rima, and what did you do about it to, I guess, be innovative in encouraging people to continue to donate during these very tough times, and particularly in Lebanon?
Yeah, so very good question. So absolutely, as we all know, Lebanon is going through a very difficult period. And we've had not only COVID, but also a major economic crisis that hit the country. and left people even more vulnerable. So we're guided by the UN 2030 agenda and its mission of leaving no one behind. And we work with the UN and with the businesses here on the ground on the 17 Sustainable Development Goals of the UN, the most important of which are alleviating poverty and hunger. So we decided to put a project on the table and to rally all business efforts around it, which is a humanitarian project to help the poorest families in Lebanon that are locked at home, not able to have access to food, but they also have the lockdown and they cannot go out for work. So our initiative was to contribute to a national poverty targeting program, which is hosted in the Ministry of Social Affairs, has identified 44,000 families that are poorest across Lebanon. And the help we're providing is through rallying donations to be able to provide those families with food vouchers that they can use to buy their basic necessities of food. Coming back to your question on obstacles and constraints, I agree with Rima that there are plenty of obstacles, particularly that I think there's a lot of competition even now in the philanthropic space, so many campaigns. So how to actually spin the value added of your campaign, how to position yourself, how to really rally businesses around the mission, and how to reach those families that are really in need. So really the beneficiaries, what we needed to do is to validate that people who are benefiting from our campaign are really the people who are most in need. And this took a lot of effort and collaboration across partners, working with the World Bank, working with the UN, working with the Ministry of Social Affairs, and working with businesses and their CEOs in order to also lobby and to reach the biggest network possible. We were very happy with the result. Within 3 months, we managed to gather $1 billion. Dollar is now the equivalence to dollar is a bit tricky. This is not because we have our exchange rate is changing by the hour, but it's a significant amount that will go to these families in need. We're wrapping up our campaign and we're very happy with the results.
Fantastic. Thank you for very much, Dima. And it almost sounds like you saw an opportunity in the crisis and really tried to leverage the connections and the collaborations you had with the private sector. And I think that's very, very beneficial. Probably something that a lot of the people, if they're from, in the audience from charitable organizations, can take away. So really what you're saying is you have to start doing things a little bit different perhaps and use those connections that you have during these times. So thank you. That's a really good point. Dr. Salsan, I might just come to you at the minute because you've heard what Rima and Dima have had to say about the challenges and the obstacles and how they've overcome those. You're in a little bit of a different sector in terms of it's not food, it's not poverty, it's more about cancer patients. So you've got a little bit of a different take on it, but can you tell us about some of the challenges you faced and how you've been able to overcome those? Did you also see some opportunity in the crisis and leverage that?
I actually agree with Dima and Rima when they said it's very hard for philanthropy in this current pandemic because they're absolutely right. There's the funders is like a pie and each one of us have a slice of that pie. So literally when that pie becomes shrinks, we are actually competing on the same resource. It doesn't matter if I'm, funding for food and funding for cancer patient, it does not really matter. But True. Again, it's all about having, at the end of the day, having the transparency with the donor and also having, as Nima said, knowing your donors and segment them very well. And I think having a good relationship with the donor helps very well as well. But one thing which we learned, and maybe that's a takeaway from the pandemic, is that they always said that the pandemic is the greater equalizer, that it does not distinguish, not like, for example, let's say an incommunicable disease like a cancer, you will have it in more high-income country, low-income country will have more infectious diseases. The pandemic is an equalizer, It can happen to anybody. It does not matter what level in society you are. It does not matter what education and background you have. It is the great equalizer. I would like to say that COVID-19 is the great accelerator, actually. Because of COVID-19, we had to go into lots of projects that we thought that it's nice to have it in the future. It's nice to have it in the pipeline. It's nice to have an online donation platform for us somewhere in the future, where we had to actually accelerate that project. Instead of it being in the pipeline, we have to accelerate it within 15 or 2 weeks, 15 days to make it viable for us and to make it live. We had to, our deadline was Ramadan. Ramadan is the month of giving in our region for the Islamic countries. It is the month that actually, if we don't make money and we don't get the funded that month, it's not going to happen the rest of the year. So that was one of our major income, and we had to really spin it off. We had to work and we had to do extra effort to make sure that we are live online. There is lots of things that we, not only fundraising that became digital for us, even how we communicate with patients, even how we provide the moral and psychological supports. Now we do a lot of those Zoom meetings instead of having, 10 women in a room and having a nice cup of tea in the afternoon, we're having now a Zoom meeting. We're gonna have a nice Zoom meeting in a week's time to meet and greet for the Eid as well, for the patient and their family. So everything's now becoming digital. And the funny thing is people are accepting it. People are not shying away and saying, oh, I can't use this, I cannot do this. And also, even the way we are providing access for treatment, we're helping the cancer patient by providing their treatment financially, that's also becoming digital. We have now online application forms, online follow-ups with the hospitals and clinics. We are utilizing telemedicine and teleconsultation very well, and I'm sure my colleague Nisreen is more capable because they have an actual cancer center. We are only a charity working with hospitals, but also we have transformed the public and community awareness into digital. I'll give you a prime example. Just today, marking the month of July, which is the summer month, we always, each year, we always produce a nice skin cancer awareness campaign. Basically, stay safe in the sun. Everybody goes into the beach to, enjoy. It's very warm at our neck of the woods. So we always have that. So, but this time we did our skin awareness campaign and being safe being sun safe. We did it in a Zoom, and for the first time ever, we actually had inmates. We had people from the prison actually joining that. I wouldn't have reached that part of the community before, because I would just send a health educator somewhere. She will be sitting in a room with a maximum capacity, whatever that is, it will still be a maximum capacity. But literally this platform of the online meeting, what is it, Zoom, whatever the other meetings, Go meeting, whatever, it really provided a greater access for us to the community. And the community is reciprocating. We are having really amazing feedback from the community. The last thing which we are doing, sorry.
No, you're okay, that's okay. I was just gonna say that's fantastic. Very positive results, and it really shows how proactive your organization has been, and I'm sure your involvement in that too. So sorry to cut you off if you'd like to continue that last point.
Just one last thing. Even advocacy is becoming now more. I mean, this part of us being in this panel is part of an advocacy. It's highlighting women's role, maybe the silver lining of all that is that when we now are crunching the numbers, we are actually having online, this platform is actually more cost effective for us. And I think in the future, moving forward, we will continue with that, because it doesn't need a venue, it doesn't need a setup, it does not need me paying lots of people to come and join, or people paying to join. It's free, the access is free. So actually I think for us as a charitable organization moving forward, we will be capitalizing on online platform, and everybody now uses it. I mean, I'm not sure, I don't think that people will shy away from it moving forward.
So true. Thank you, Dr. Salson. You covered a lot of points here, so that was very comprehensive, and I'll come back to some of those points because I actually wanted to ask all of you about some of the points that Dr. Salson has raised, but I might just bring Manna into the discussion at this stage, because Manna, when you were first introducing yourself, you're talking about, you know, the need to be proactive and what you were doing to be proactive, not just waiting for things to happen. So a little bit like what Dr. Salson said, we could see a lot was happening there about charities forward thinking and really creating opportunities out of crisis. Can you tell us what you did and how you did it? Sorry, Manna, you're on mute.
There you go.
Okay.
I was saying that to Dr. Salson's point, 2 years ago, there was a survey that was done of about 3,500 nonprofits, and 50% of those 3,500 nonprofits said that they work on cash, which is, you know, which can last them only 3 months. And 19% said that they only have cash on hand for a month. So that's a very, very fragile way of doing business, you know, and nonprofits, even though we call them nonprofits, we are still in the business of helping, and we need to keep that in mind. So I think this time with COVID has given at least a gift, you know, we have to almost repurpose the way we do business, because I said we are very proactive, but no one was thinking COVID when we planned for 2020. So we really had to change our strategy and look at what was the need of the hour. You know, and the need of the hour was their family suffering, the people losing their jobs. In Los Angeles alone, we have 66,000 homeless people on the streets, which has gone up this year. People didn't have food because they were losing jobs. Mm-hmm. So we decided to use the need of the hour to repurpose the mission in a way. Yeah, we do education.
Are you saying that you actually changed the strategy completely?
Yeah, okay. We did. And, you know, the two biggest things for nonprofits, one is people, which is volunteers, mm-hmm. and the other is funds, money. So both those things were in shortage for many, many nonprofits. People didn't want to go out and volunteer because, and this is initially, right now things are getting better again. The first month of COVID, people didn't know, so they didn't want to go out and volunteer their time, mm-hmm. you know, with the fear of getting COVID themselves. And obviously, most nonprofits did see a drop in their funding. Doesn't matter whether you're based in the United States or Lebanon, everyone went through that drop in funding. So we decided to repurpose and pull funds from other initiatives that we know. We have a sports initiative, and we know that we can do that this year. So we pulled funds from that program into something called COVID-19 Together, and we started sending out food and care packages to the local communities where we knew that people had lost jobs or the kids were starving, but the food was bought from small businesses. So we were not just helping small businesses keep running, but at the same time helping communities by providing them care packages in the United States, South Africa, Cape Verde, Sierra Leone. We sent a whole lot of food and care packages. The money obviously came from other initiatives that we know were stalled for this entire year. We couldn't do that this year. So we took money out of that. That is repurposing yourself, you know. It got better. I cannot tell you how surprised I am that communities came together. We had these restaurants who they had not received any funding from the government. They were still waiting for it, but they decided to donate huge amounts of food to these families. And that shows you how people come together during such situations. You know, you just have to, as a nonprofit, your job is to show them the way, show them how they can help. So a great example of that would be, we have something called school sponsorships, where a sponsor would, sponsor a child for school for an entire year. Now we know that people have lost their jobs, and there's a chance that they may not be able to do it this year. So you create payment plans. So we decided that the donors didn't have to donate the entire amount of the school sponsorship in one donation. They could actually do monthly plans. So you just make things easier for people who want to give back, whether it's their time, services, money.
So it sounds like you really were innovating. So, if the key takeaway points that you've made is that you had to readjust, you had to re-strategize and repurpose, as you put it. And you innovated.
There's opportunity in every situation. There's huge amounts of opportunity with COVID-19 for nonprofits. Think about a CEO of a nonprofit that you donate to calling you personally to thank you. The CEOs at this point have the time to do that, right? So take that time and make a phone call to your donor and say thank you. I mean, they'll be like, wow, they will stick with you. Maybe they may not give you $100 this month, but you know that donor is going to stick around with you because you've made that phone call. And this downtime is giving us that chance to just sit back and work on those things that, get pushed aside when things are busy. Yeah.
So true. So true. Thank you for so many of the points that you made, Manna. They were they were on point, if I can put it that way. Barbara, I might just take the conversation over to you for a minute, because we heard about Manna, I guess Manna's message about really being agile, nimble, trying to repurpose, realign, focus, but also change the mission because they felt like they were needed to address what the need was at the time, in particular during COVID. So you're from UN Women for Peace. Did you do any of that re-strategizing during the COVID period? I mean, let's go back to what your mission is and then how it was impacted or affected during COVID, and tell us a little bit about the strategy of the UN and how you were delivering your message and reaching the people that you needed to make an impact during those times.
Well, COVID-19 really showed us that even though we have tremendous advantages in technology, and we have done so much to take us from the cave to where we are today. We have tremendous capacity, but take a look how many issues there are that confront people, and especially women and girls. The rise in domestic violence has been precipitous. As a matter of fact, Secretary General Guterres was saying that the rise in domestic violence and against women and girls has reached proportions that the whole world has to pay attention to. So we are an organization, the UN Women for Peace.
Sorry, I think that Barbara has dropped off there. I don't see her anymore, and I can't hear her anymore, and I'm not sure if that's the same for the others.
Yes. It is.
Okay. So what I might do is give her some time to come back on. I'm sure she was making a very valid point, but what we'll do is we'll just take it to the Nisreen for the moment while Barbara, I guess, joins. Sorry, is that Barbara? You're back. Oops. I think it's playing up there. That's okay. Nisreen, I'll take the conversation to you for just a moment. Can we hear a little bit about the challenges you faced? I guess a little bit about how you adjusted and what you did during these times to advance the work that you're doing. And I know that it's very similar and connected to Dr. Sausan. So, and she was saying you've done some amazing work. So can we just hear a little bit about that and what your message to people that are in a similar organization are making a change? Sorry, Barbara, we'll come back to you in just a moment.
Okay.
I've just asked Nisreen a question, so I might get her just to answer and come back to you. Maybe you can at that time sort your technical issues. Thank you so much, Barbara. Thank you for your patience and kindness.
Okay, thank you.
So as I mentioned in the beginning, patients' care continuity is #1 priority for us at all time. We have no other option than making sure that our patients and their families are getting the support that they need during their treatment, and they get access and equal access and continued access to their care all the time. Due to the lockdown measures, we introduced new measures and new techniques to ensure the continuity of the care and treatment for our patients. That included home visits, expanded our virtual clinics technique for our patients and their family, the counseling sessions, one-on-one counseling sessions through virtual and home visits as well. In addition, of course, to new measures that we took in order to control any infection that our patients may be subjected to. So this is from the patient's care front. On the other side, you also have in such situation to take care of all your stakeholders, the patients and their families, your partners and donors, and your team as well. So for the donors, we did what Dr. Sausan mentioned in terms of a fully fledged digital transformation that we dreamed for years before, and we thought that this may take us 3 to 4 years to accomplish. We accomplished all these new technologies and new and the objectives and goals, the strategic objectives and goals of digital transformation in 4 and 6 months. So we completely transformed into a digital organization in terms of increasing access of our donors through online donations, increasing reach through online campaigns and digital platforms, in addition to engaging more with a new segment of the society for donation in specific through virtual gaming, virtual fundraising events, engaging more social media influencers in our campaigns across the board for awareness, for donation, for fundraising. We reconnected with our long-lasting and loyal partners. It's easier in such a situation to convince your loyal partners and donors to give you back. So we started with them. And we also customized our communication strategy and marketing strategy, and kept reminding and customizing our messages and reminding people that there's cancer patients that needs our attention and support. COVID-19 will go, inshallah, and we will overcome it. However, cancer patients needs our support, especially the vulnerable and most in need people like the refugees and displaced people who are really in their support for all, in their need for all our support. In terms of our team, I always remind my colleagues and myself that we have a huge responsibility to make sure that our team are fully engaged, fully aware of the situation, and it's our responsibility to keep them energized, to give and do their best, and to remind them that they are the voice and they are the supporters of these voiceless people, and they have to do their best to make sure that we continue our mission in saving lives and supporting cancer patients and their families.
Thank you, Nazreen. And it sounds like you've absolutely done a brilliant job during the toughest times. I mean, you know, there is no doubt COVID has put pressure on, you know, governments, organizations, and individuals in ways that we never imagined. But to hear from you the work that you've been doing and how your ability to really adjust and innovate. I mean, who would have thought bringing in gaming into a charitable organization and, you know, trying to connect with donors in that way. So thank you. Thank you for sharing that with us. I might take the conversation back to Barbara, and I really apologize, Barbara.
Yes.
I hope now that technical issues are being sorted. So
I hope so. I hope so.
Perhaps we can go back to the conversation we started together about, you know, the UN, Peace for Women, and it's a message, how it got that message across, what challenges and how you have adjusted during these times.
Well, there are tremendous challenges. And of course, we have to utilize this new technology and Zoom and all of these different structures that we have to engage in. But we've really looked at the architecture of what's causing this tremendous uncomfortable situation in humanity. Basically, why are women and girls so disadvantaged in the world? And what we've decided is that we're going to do some collaboration. Specifically, one of our directors, Stephanie Winston-Wolkoff, met with one of the co-directors of the Yale Center for Emotional Intelligence. And what has initiated by that introduction with these two people and with the Yale Center for Emotional Intelligence and the United Nations Women for Peace is a collaboration and an understanding to change the framework of the way society and education will be introduced into the curriculum of children. so that we can change this mindset. We have to change the mindset. We have to change the architecture, because the architecture that we have engaged right now and that we have in place is not working. We want to change, in fact, the DNA of violence. In order to do that, we have to totally be an irresistible wall of determination in doing that. So we want to engage not only civil society, not only corporations, but engineers, the people that are going to the moon, astronauts. We want to engage this different group of people so that we can change the framework and the architecture of the way humanity has created these tremendous problems. So we're taking a different perspective than the ladies that are working so hard. And I honor all of you, and God bless all of you for the work that you're doing, because touching one life changes the world. And each person contributes, and you're out there on the ground doing the work. We in our organization are reaching out to a lot of individuals and the corporation, but also to the scientific community of how we can change the education, how we can change the opportunities. So it's a different template that these other ladies are working on. And of course it is difficult, but we do have open minds and open ears, because the COVID has showed us that we are all in this together. We rise or we fall all together. And I think that people are very receptive now to listening to all of these messages. And because we have COVID, we see all the misery more face forward than we have in the before. As so many people are animated, we have celebrities, we have philanthropists, we have individual people that are doing such incredible work. And what our organization is trying to do is put it all together, create a new framework, a new architecture, a new mindset, using all this brilliant technology and trying to reconfigure society so that people suffer less, especially women and girls.
Thank you so much, Barbara, and very valid points indeed. And I think, you know, as you say, it's just one person with one mission that can really change the world. And it's just little bit by little bit, all these women making these amazing impacts on the world that's going to change the world. Rima, I'd like to come back to you, because now you've had the benefit of hearing from all the other speakers and, you know, listening to what they're doing or what they've been doing, how well they've been doing, what challenges. And I know when we first spoke with you, you mentioned the challenges that you faced during COVID. But can you talk to us a little bit about your strategy going forward, how that might change? Will you perhaps adjust or repurpose and realign a mission or change the mission? You know, how will you engage more people? How will you reach a wider audience? I'm sure you're doing that at the moment, but during COVID, you were saying there was definitely a challenge. What is the strategy going forward for yourself and the organizations you represent?
For me, well, first of all, this is a very important question. So thank you for that. And I think a better way to start this question is by a quote. I would like to quote Princess Diana, who once said that I knew what my job was. It was to go out and meet the people and love them. And for me, I started my journey. I actually worked with organizations before I was crowned Miss USA. But when I received the crown of Miss USA, it actually arrived to me by surprise, because I was actually entering pageants to continue to law school, and I really needed scholarships. And so when I was, you know, fortunate enough to be crowned Miss USA, I decided that I was going to use this crown to really shake the world. And right now, what I'm doing with that is not only bringing awareness, but utilizing the fact that I can be in the media, be able to connect with celebrities or high-profile people, and hopefully reach out to them for their help. There is a lot of people who are fortunate enough to do so good in their careers that want to give back and don't know how. And I feel like I can use that key to our benefit to bring this back to these charities. For example, World Food Program, my husband and I worked together to raise money for Lebanon because we heard about the hunger crisis. And within 24 hours, we were able to raise $100,000. And that was remarkable, but that was thanks to a lot of the celebrity and the high-end profile clients that my husband works with and we're friends with. So I am going to hopefully use that as a key source to bring back to these charities that I'm part of, especially CCCL, that really needs the help this year. And hopefully we can see a big difference within the next year.
Thank you, Rima. So it sounds like really for you, it's about the power of collaboration and leveraging those connections that you have to really make a difference in the organizations that you're contributing to. And I think that is key. I mean, even with all the technology, even with us adjusting, realigning, you know, changing the mission perhaps, or bringing, at the end of the day, charitable organizations rely on people, and it relies on the goodwill, and it relies on their intrinsic motivation to collaborate, to a higher purpose, to a bigger purpose and a greater purpose than themselves. So, you know, I'm sure that you'll be successful in what you do. And you're right, power of collaborations and leveraging connections is so key, very key. So
Absolutely.
What I might do now is not change the conversation so much, but talk a little bit more about the power of women in philanthropy, the advantage that women have in being in the positions that you have, making the impacts that you do every day. So I just want to hear from you about why it's so important for women to be in the positions that you're in, what you think the impact that women have and can have that not greater than our counterparts. Let's not put it that way so we don't offend the men in the room, in the audience, but surely, you know, women, it's almost intrinsic. I like to think that it's part of the nature that we contribute, that we give back. And so when we're in this role, it's almost so natural to us. But can I hear a bit more from the speakers about that? And I might go to Dima. I see Dima nodding her head at me. Dima, what thoughts do you have on that point?
So definitely, I think that women have a big role to play. I think this is an incredible talent women bring to the table, and it's underutilized across the world. And I think women work with passion and compassion, and they have a humanitarian face. Not that men don't have it, but it's something that's almost innate to women. And I think that they have so much to leverage in philanthropic work and humanitarian work. I also want to say a few words that I learned so much from this panel. And I think my key takeaways is that in every opportunity, in every threat, there is an opportunity. So when there is a setback, let's always look also at the opportunity. I learned about the power of partnering and mobilizing joint efforts, because you can amplify your results by reaching out to different kinds of partners across the spectrum. We learned that we need to be agile during crisis and to be flexible and to repurpose, be open to repurpose, re-strategize. One of the techniques we used is also to go digital, which added to the transparency and credibility of our campaign and made it all the more successful. And I want to end with a very deep note that yes, what we're doing in philanthropy is important, but I think what the women have an even more important role to address inequality in general. We have inequality that is so embedded now in our societies, and we're trying to alleviate some aspects of that through philanthropy. But I think the bigger struggle is really inequality, and this is what Barbara touched upon, that we need some kind of re-architecture and reconfiguration of how we think about these issues. And this is why education is a very important form. So I'm just going to end it there with some takeaways. And
perfect. Thank you so much, Dima. And you think so much like me. You should have been the moderator for this event, because I was just taking it over to Barbara and you said it just before I could say it. Barbara, she made a very valid point, and I want to hear from you about this, because I know, or my sense is that it's by women for women, and you really can appreciate and I guess for you, it's changing that social fabric. And I believe your message is it starts with women. So tell us more, Barbara.
Well, absolutely. And I feel that because we are mothers and daughters, and we have the human race has men and female and people, all different kinds of people. But I think the feminine intuition is so incredible, and also the way women look at issues. Our organization, the way we see it, is a big tent. We have all these situations, all these problems, but at the end of the day, you must have a vanguard organization that puts all of these other organizations together, which do splendid work and they do God's work. I actually invite all of you to join with us collaboratively, because collaboratively we can have a tremendous impact. We will be formidable in our efforts. And the idea is the collaboration of all these organizations, many of them headed by women with the vitality that women have, because the biggest problems stem from the inequality, as this lady has just mentioned. Absolutely, this inequality has positioned society in such a way that all of these other problems, which are actually innumerable, will be able to be processed. We have technology now where they are producing algorithms, they're producing ideas that are so transformative. And we have to look at these things. This COVID idea actually showed us that we have to really, really up the ante in our technological abilities. And that's why I invite people that use mathematics, that use algorithms, that use all the scientific data, so that they can reconfigure, because we have enough capacity to feed everyone in the world. We do. We have the capacity to clothe everyone in the world. We have the capacity for people to be addressed and educated. We just don't have the system, we don't have the structure. And I hope that our organization could put together all these brilliant ladies that you have here today. And I am so pleased to be here and so honored. And I thank you, Soraya, for being such a beautiful and wonderful moderator. I really, really appreciate it. But I want to put out the voice that we can change this structure and we can change humanity by education, which is tremendous. We have to change the dynamics. And that is a really, I think that on top of all of the work that we're doing and all the capacity that we're putting out to helping people with individual problems, I think if we could change the mindset of the people that really govern, because they are the ones, you know, the governmental agencies are very important. The heads of corporations are tremendously important, and they do get together. They do work collaboratively. I want women's organizations to be right there at the table with them. And if we have a strong enough voice, if we have sufficient mass, our voices will be heard and we will change the dynamics of the world. So this is what I do every single day, and that's what our directors do and our board of advisors. And I invite all of you to be our great collaborators. I love all of you, and I thank you all.
Thank you so much, Barbara. Thank you. That was very heartwarming and some very valid points. So thank you for that. Manna, I might just take over the conversation to you quickly. You know, you seem to be young, you're vibrant, you've got the agility, you've got the vision that, you know, all these women on the panel were talking about today. And so can you give us a few words about women that are moving into charitable organizations, who are starting young, who perhaps, you know, whose vision is larger than life itself, but then they hit roadblocks? What's your message to them? And I can see lots of questions coming through, a lot of them actually directed to you, Manna. So I'll come back to you in the question time.
So now
give us your last words.
So here's the thing, right? For your question, the way I look at this is women are half the talent of human race. Like, you cannot ignore half of the human race if we want to have a great economy, we want to, you know, evolve as humans. We have to be inclusive of diversity, which includes men as well as women. You know, the boards of directors need to have men as well as women, because we just have different leadership styles. And especially in the 21st century, leadership revolves around a couple of things: connecting, collaborating, empathizing, and communicating. And all those four things are natural to women. It comes very naturally to us. And I'm not saying that they don't come naturally to men, but women empathize way more.
I might just jump in here, because I've just seen a point that's come through by one of the audience, and they said most men don't have it, trust me. So I think there are men in the audience that will are agreeing with you at this moment.
But I'm all for, you know, the other point I want to make is I've seen these, you know, corporations where they push women to be in the leadership positions. What people don't understand is that that's great that you are pushing and encouraging women to take more leadership roles. But along with that, you need to have an education campaign for your corporation where the male counterparts are educated on being comfortable with a woman in leadership position. You can't just keep pushing women to go for it and not have your company or your society move forward to accept it and be okay with it. You see, we lack that. We just, we put the burden on women to go get that leadership position, apply for the CEO job. But is my company going to be okay with it? They should be. And if they're not, it's my job and all the other people, the board of directors, the leadership, the management, to make the culture comfortable with women in leadership. And I don't see that happening enough. And I think that's where the emphasis needs to be, is educating. And I'll give you a great example of that. When I go out for, we do a lot of work between, but we have like partnerships with governments, okay? And in some of the countries that we work with, it's always me and our chairman and the two of us. And there have been times when we are at the table and the head of the state that we're talking to would only talk to Keith, who's the chairman, the guy at the table, and I would be non-existent at the table because I'm a woman. But that's cultural to many, many places that we work with. So it's also Keith, my chairman, his job to educate this other person and make them, push them out of their comfort zone and make them okay with the fact that there's a woman at the table with similar stakes. I have more same amount of power in decision making at the table as he does. And it's his job to educate everyone around to make them comfortable with a woman in a leadership position. It's not just my job. You see what I mean?
Yes.
So we can't put the burden on women. It has to be an effort.
Definitely.
Everyone has to come together and educate people to get comfortable with women in leadership positions. Definitely.
And thank you, Manna. Thank you. And what I'm going to do is take the conversation over to Dr. Salsan, because Dr. Salsan is Director General of the Cancer, or General for Friends of Cancer Patients UAE. I mean, and you're in this position really at the forefront, if we can put it that way. So Dr. Salsan, what is your message to women in philanthropy? What is your message to even the men in the audience and charitable organizations generally in moving forward during these tough times, but really powering on to deliver the message unrelentlessly?
That's a very good question, actually. It's actually encompass all what you have been saying for so far. I think the core message here, first of all, let's go back and see women in leadership in general, what they have done. I mean, if you see there's lots of articles throughout the pandemic that said that the countries that were led by women actually did very well in the pandemic. So giving the example of Germany, Merkel, giving the example of Australia as well as Australia, New Zealand. So it's interesting to see that women in leadership, political leadership, has managed to actually steer their country ship to the safe of beyond COVID, and they are progressing from there now. So it's interesting to see that, because that's an interesting model. And I do agree with Manna in what she said. It's not about just pushing women in leadership just because we want to fill a quota and because we want to say, as an organization, we are progressive and we have women in our leader. It's about who's the fittest, are they fit, are they well equipped, and is the environment ready to receive that kind of a new leadership or a new vision. I just reflected when Manna was talking. We just reflected on a article I read, I think it was 2 days ago, and it was reflecting on the very famous Darwinian theory, which is said the survival for the fittest. And it was a group of anthropologists. They were actually talking about, yes, Darwin said survival for the fittest, but fittest of what? Fittest of strongest, stamina, what is it? So when they actually looked into animal behavior and their evolutionary trend, they found that the the animals who were more friendlier to each other, who helped each other, were actually more on the evolutionary step than actually other animals. And there were two types of monkeys, chimpanzees and another type of monkey. The other type is like they will feed each other, they will help each other, where chimpanzee will be very aggressive toward each other. So I think we are, and again, I reflect on what Barbara said, I think we are in the era and we are on that stage. I think the pandemic have changed us in lots of ways. Maybe we're not aware of it yet, but we have changed, definitely, as an individual, as a human being. And what Bob was saying is we are looking now, we are trying to find our new utopia. It's not going to be a utopia, it's going to be a reality, because we are all going to be a community based on equality, but at the same time based on love and kindness. And I think that's what Rima also mentioned. She mentioned the word love, which is a very important word. And I just want to say one more thing. As an organization, we always strive to become a learning organization. And a learning organization is the higher peak in any management. Any organization dreams about becoming a learning organization, because it's not just about learning from within, but also exporting that knowledge to other entities or to other segments of the community. And one other key, I think, take away from all this, which I'm very happy to be, and thank you, Soraya, for leading such an interesting and rich panel, is that I like the word, I think it was Dina who mentioned it, it's the word compassion. I think we are now, I've heard this word many times actually in lots of conferences and events. The last time I heard it was in a conference in India for palliative care, and they were talking about giving healthcare in a compassionate way. Okay, so it's not just providing healthcare, it's compassionate care. So I think that's where we're moving. Again, it's just exactly what Barbara is building on. It's that the collective humanity we are putting in our community, we're putting the humanity back. Thank you, Soraya.
Thank you so much, Dr. Sarasan. And, very, very valid points. Even though we evolve and even though there's technology and it doesn't matter what I guess humans are facing, love and compassion is what takes us through to the end and really impacts. It's the greatest impact that we could have in the world. So thank you so much for that point. Nizreen, just really quickly, I'd like to hear from you your final words before I move on to Rima. I'm just conscious of time. I don't want to rush anybody, but I know that there's lots of questions by the audience, and I'm sure they really want me to put those questions to you. So, what can you tell us from your perspective about women in philanthropy? What message do you give to everybody in the audience about how to really move forward, in charitable organizations and make an impact, really continue to make that impact?
Yeah, to make it brief and building on everybody's note and inputs, I do agree that we are living in a world where competencies and skills should be the main thing to evaluate people against. So regardless of being women or a man, you have to give, you have to be committed. There's thousands of individuals and groups who are vulnerable, who are voiceless. They need us. They need us to rise up to the challenge and really being committed to serve them with love, determination, being innovative, and skill ourselves with competencies and skills needed really to continue our work and support all of these individuals and societies, regardless of the cause that we are working on. There is a commitment from all of us as leaders and as team members to make sure that we continue our missions and serve our communities as best to the best that we can do.
Thank you so much, Nizreen. And I'm sure, and no doubt we've heard from you today, and you're absolutely doing a brilliant job in the organization that you work for. Rima, last but not least, I have to come back to you and really ask this question, because you're a role model to so many women. I mean, particularly in the Arab women globally. What are your final words? What is your final message to women in philanthropy, philanthropy organization and men in that space? What are your words to really motivate and inspire and drive them to keep contributing?
Thank you for that question. And I definitely want to bring back a point Dima brought up, where she said, with every crisis brings opportunity. And I think this is a really good time for women to step up, because women, as someone just said, is that women have been proven to be one of the best leaders. I thank you for mentioning how many women leaders and presidents are out there, especially the president of New Zealand, who has proven to show that she's conquered this COVID crisis. And that's beautiful to see a woman really take charge. Women are compassionate, they're reciprocal. And this is not just for Arab women, this is just for women all over the world. And what I would love to advise and empower women to do is to keep going and to not stop. Even when there is a crisis, this is where women are needed the most. And also, we're mothers, you know. I'm a mother of 3, and for me, how I raise my children speaks to the future. They are our future at the end of the day. So also, I would like to mention an article that I think I brought it up to you, Soraya, and it was about Esther Wojcicki, who raised 3 very successful female daughters. One is the CEO of YouTube, one is the CEO of 23andMe, and the other is a college professor. And when you ask her how she raised these 3 world-shaking girls, she says that basically I made sure that they were an effective and a functioning human being. I made sure that they saw that the world was not just all a happy place. I had them learn about failure. And this is very important because look what's happening right now with COVID. The way we raise our children speaks very high and loudly on how our future is going to turn out. So as mothers also, we have that power to really make sure our children is raised prepared for what the future might bring.
Thank you so much, Rima. And I couldn't agree, anymore, because as a mother, and I'm not in the, I guess, philanthropic space, although I contribute, but I'm not leading one, and I hope that I will one day. But, your message rings so true. And it's so inspiring to hear, because you're right, it really starts from the home, and it starts with the young ones. And it's instilling those morals and those values from such a young age so that they can grow to be like, the panelists today on this webinar. So thank you so much. Really inspiring panel. I'm sure there's lots of questions coming through that we're going to get to in a minute, but I really need to thank everybody today for being on this panel, for really imparting your knowledge, your experience, your message and inspiration for those out there who are either, donors or in organizations that are trying to do what you're doing. You're really inspirational. So thank you so much. Look, for the final words today, what we have is a message from, and I don't want to pronounce it incorrectly, but it's Mrs. Ban Sun Tayek, who is the patron for UN Women in Peace. And I'd like to ask Forbes to just show this video, because this video is actually powerful in a sense that she summed up, even before she knew what any of the speakers were going to be speaking about today, she has summed up all of the messages of the speakers, and she does it so well. So we're just going to listen to her. It's a few minutes long. If I can ask somebody from Forbes to play that video, and then we'll go straight to the questions, and I'll direct those to the speakers to hear all your answers today. So for the participants, please stay with us. Let's see this through to the end. And without further ado, Mrs. Ban Sun Tayek.
Hello, everyone. I am Ban Sun Tayek, and I am the proud patron of the UN Women for Peace Association, which offers its efforts, know-how, and resources to enhance the participation of women and girls in building a culture of tolerance, respect, and peace around the world. The coronavirus pandemic has exposed many of the existing weaknesses of our societies. It has also changed family dynamics, which have put additional strains on families, and especially women and girls. Gender-based violence also continues to be on the rise worldwide. I sincerely hope that all of you and family members are doing well during these difficult times. We are facing collective trauma that requires collective healing. Non-profit organizations need their committed supporters, especially in these trying times. And while many things may have wavered during the pandemic, the power of our ongoing duty to support is and must remain stronger than ever. We are always on the look for new ways to sustain and diversify funding for good causes. Volunteering safely, for example, could take on some of the necessary tasks and fill important gaps in service. We must also analyze scientific data and measure the real needs of affected people, and we must make sure that women are at the table, involved in decision making, to ensure we come out of this crisis stronger, more equitable, and more connected. Philanthropists must continue to stay active and engage listeners to address these new challenges and continue fundraising to assist organizations more than ever before, as we are in this together, and only together will we be able to turn the page. Speak up for the growing needs and share your experiences of how you help others, which in turn can inspire others to be active in their giving as well. We know that uplifting women and girls is central to uplifting societies overall, and therefore central to achieving the UN Sustainable Development Goals 2030 and to building back better from COVID-19. Because while women are disproportionately impacted by crisis, they are proven more likely to have the innovative solutions required to move towards the brighter future. Building back better means ensuring economies that are stable, diverse, equitable, and protective of our climate. Building back better means education for all, no hunger, freedom, and leaving no one behind. Empowered women are the ones who will ensure this equitable future where our most vulnerable communities, our planet, and our economies receive everything needed to thrive. Giving now, especially to the needs of women and girls, is ensuring not just recovery, but prosperity for everyone. Despite the many global challenges we face, we can collectively sustain hope for a better future. Dear ladies and gentlemen, dear friends, let us work together to make this world better for all. Thank you.
So thank you very much for listening to that. And they were very wise words from from the patron of Women for Peace. to be honest, she really just sums up everything in the best way that she could, and brings in, you know, all of the points that you were speaking about before. But without further ado, let us get straight into now the questions from the audience, for those that are still with us and really want their questions to be answered. And Dima, I would like to start with you, because there's a question that specifically addresses you, and they'd like to hear your viewpoint. So I'm just trying to look. Oh, I saw that a minute ago. Oh, yes. So we have a question from Aya Sharif. I hope they're still in the audience. So what they've said is, we'd love to listen about women as lawmakers in the capacity of MP Dima Jamali as a female parliamentarian, maybe in the future. So,
that's a very good question. Today I spoke in my capacity as heading this UN network. But I also wear the other hat. I'm currently a member of the Lebanese parliament, one of 6 women that were recently elected in 2018. And we have 128 members of parliament, and we're only 6 women. And basically, for me, I was the first woman ever to be elected from my city, which is a very conservative city north of Lebanon. But the journey was not easy, because I think this brings me back to something that many of the panelists touch upon, is that your society has to be ready to support you in your new role. And I think Lebanon is still getting used to the idea of women in key leadership positions in politics. So I think it was a tough journey at the beginning, but it was quite a bit of a struggle. But I'm much more adjusted, and I'm definitely much more into my role as a lawmaker. And I think there is a great opportunity through parliament and legislation to reinforce the role of women and to really make a difference, because we can empower women also through the appropriate legislation. And I'm working actively on that. One of the key laws I have on the table now is a quota system for women in in parliament, in politics across the board, and all elected governance structures across the country. So I think that was a very interesting question, but it also gave me an opportunity to share my experience. I'd like to come back with some closing words on this panel, just to bring us back to, I think that women have an opportunity to really make a difference and to make a change. And for that, we have to be resilient. We have the commitment, we have the passion and compassion, as we said, but also we need resilience, because as we said, there are many obstacles along the way, but we have to keep the hope and we have to keep the momentum for change. There are so many people who are in need, and I think we are able to reach out and use our talent, but also mobilize the talent of others around us to make a difference in their lives. And this should be something like driving our drive. Should not stop, even with obstacles, even with stereotyping, even with all the pressures that we face. I think it's very important to keep going. So that's my message.
Thank you so much. And it's so true. But congratulations on your recent, big achievement. Hats off to you. You're doing an amazing job, I'm sure. I'll take now another question from the audience, and this is about cancer patients. So I might direct this to Dr. Sausan and to Nazreen. So one of the founders and general managers of Aid and Hope program for cancer patients, Iman Shanan, has said cancer patients in Gaza are awaiting death once due to severe shortage of medications, due to banning them from traveling to receive treatment that is specific for radiation and only can be received outside of Gaza. So what do you think the best strategy is to help patients in these circumstances? Dr. Sausan, can we hear from you, and then perhaps hear from Nazreen to answer this question?
Actually, Nazreen is more equipped to answer that, because they actually run a compassionate program, and I'll leave it there. She can speak about their compassionate program. But as Friends of Cancer Patient, we actually supported, we have an international fund, which is called Amira Fund, which was launched 2 years ago in memory of our latest president, who passed away very young, very tragically, actually. And she was a great woman. Her name was Amira, and she was actually a woman that empowered other women, to not just in philanthropy, but also in business. So we use that fund to support international programs and to help cancer patients internationally, but also to provide capacity building for hospital. Is it needed, medication needed, equipment needed? But going back to the question, unfortunately, again, it's going back to inequality in healthcare. This is simply politics interfering with humanitarian issues. That's it. That's the core of what's happening here. We do our best to support. We do our best to support in treatment. We actually supported recently in Gaza chemotherapy sessions for almost 50 children with cancer, so childhood cancer, but definitely we do our best. But at the end of the day, if there is no political will to make this help, again, philanthropy, and we spoke about partnership in this panel a lot. And one of the partnerships that need to be actually very much paving the road for more support is a political partnership. Going back to what Dima is saying, also having human rights lawyers, having people who actually understand the law helps a lot, because those can be the front line to philanthropies in the future in these unfortunate circumstances. But again, Nasreen, if you want to talk about your compassionate program. Thank you.
I think this is an exact example of the voiceless people who are being denied of access for quality care, and even not quality care, for any care related to cancer treatment, just because of the political pressures and political situation. This is an exact example that really needs all our voices, all our support, from different perspectives, from the human rights perspectives, from the women empowerment perspective, and from the celebrities and the pressures that celebrities like Rima can put on the political people and on the political agendas, really to ensure that such people have equal access to the quality care, regardless of the geographical place that they are belonging to. So in this specific case, and with Iman Shannon, we at the foundation created a very special fund, Goodwill Fund, to support the treatment of the underprivileged women who are living in Gaza. The fund is named after a woman who passed away because of the political determination for her not to get the timely treatment. Her name is Farha. So we created Farha Fund, and through this fund, we helped tens of women from Gaza to get treatment. And actually, also we got financial support from Friends of Cancer and Dr. Sausan toward this fund to make sure that also the financial burden is not a limitation for women to get to their treatment. We are doing as much as we can. We are doing our best in terms of providing the financial support, in terms of providing the actual experience exchange. Even some of our doctors are going to Gaza and other parts of Palestine to support doctors there and build capacities and train their colleagues there, not only doctors, but also nurses and radiographers and all our medical team. But there's always limitations beyond our capabilities. However, we need really to join forces and work together from different perspectives and angles to make sure that such voiceless and vulnerable groups and individuals are being served with equal access and with equal opportunities.
So true, so true. But brilliant examples that you've used, and it really highlights the proactiveness, Nazreen. I've got a question now for Manna, because Manna, this question I think really relates to you, and the question is, what ways do you suggest to help expand a new startup charity and organization? And there was lots of points that you touched on in your conversations with us, and I think you might be able to answer this question adequately. What is your suggestions?
Well, so number one, I can tell you, because I you know, I was at the American Red Cross, so I've seen how large nonprofits function and then what it takes to start a nonprofit, which we did with Give. And it's really showing, number one, showing people what you're doing. So typically people think that, okay, you know, I can go raise money and do X amount of work. It's actually the other way around. You got to start somewhere, which is when people trust you to donate to your organization. So identify a community or an area around you where there's a need, identify what the need is, listen to the people so that you understand what the needs are. And, you know, that's where you start. You don't start by first raising money, you start by first doing, you know, the act of providing the aid, whether it's through products or so for me, there's a small community on right by the border of US and Mexico. It's 10 minutes from San Diego. You cross into Mexico and it's a completely different world. So a couple of years ago, I went down there to see a child who had brain cancer. She was 2 years old, and her mom had abandoned her, and the only caregiver was the grandmother. Oh, I found out about her on Facebook through a friend. So I have connections with American Cancer Society, and I was like, okay, maybe I can help this child, you know, connect her with them. So I went down there, which is what we always do. We verify before we spend any kind of funds. So I went down there to meet the child and ended up seeing all these other kids. It's a 800 family, 800 household slum. And no water, no sanitation, no medical care, no education. It's 10 minutes from the United States border. So you got to identify communities that really need your support, your help, and rally family and friends. When you're a small nonprofit, that's where you start. You start with your family, start with your friends, educate them about a certain area that needs help. That's what we did. That was the first community where we started working, and now we go down there every 2 weeks. We have some amazing success stories. The child who had brain cancer is 5 in school and clear of cancer now.
Amazing, amazing.
Yeah. So, but when you share those stories on social media is a great tool. You know, when you do work, you show your work. That's how people trust you. That's how people trust your mission and your vision. You gotta share. Don't, you know, I get so many comments of people saying, oh, we do good work, but we don't take pictures or videos. That's not what nonprofits are. You gotta create the trust relationship with your donors, and you have to show where their funds are going. And it's really
about
important.
Transparency, isn't it? It sounds like you have to be transparent.
Absolutely.
You're meant to be collecting money from donors, showing them exactly what you're doing. Such a crucial point. Thank you so much for that.
And a real quick thing, you know, even today, we reach 10,000 kids. We don't have an office. We don't put donor funds into buildings. We don't put donor funds into things which are completely not necessary. Everyone's working from home now. You know, you could be mobile and working. So if someone's giving you $1, your goal is to make sure that at least 92 cents of that dollar goes into the program and initiative. That's how people trust you. You should be able to show them that you put all of that money that they trusted you with into helping someone. That's where you start.
True.
Yeah.
So true. I think a very, very crucial point. And
it's very getting down to the basics for like smaller nonprofits, you know.
So true.
Different once you grow, and you just have to adapt. The only thing I think people should continue doing, which we do, is each one of those 10,000 kids that we help or empower, I know each one of them, you know, and I'll continue to know each one of them because that's important. It's important to not create numbers, but people. You know, you need to know who you're serving and who you're helping.
So true. Thank you, Manna. Barbara, I'd like to come to you for the next question. And the next question is, you know, how do you think we can together take concrete measures to rescue organizations that are really at the brink of collapsing during these times?
The outreach is tremendously important. The social media, a social media campaign aimed at all the NGOs that we can identify. There are 10 million of them at least. I think sending out and saying, collaborate, with us, even digitally, even over the internet, and realize that we are looking at you. We will incorporate your information as we are collating all of this data so that we can reach out and formulate a system. I mean, we have to formulate a system where we can collaborate and perhaps find the partners that are in the same space as that NGO that's suffering. And perhaps collaboratively, they can engineer some sort of a platform where they can survive. You have to realize that we have 9 billion people on the planet, and we have so many things going on but we do have the technology where we can locate and collate and put people together that are facing these kinds of situations. So I think that if we could reach out to enough people and tell them, look, we are at the vanguard of this process. We are trying to change the architecture, as I mentioned before. We have to have the nucleus of a new global ethic. Underneath that umbrella, underneath that vision, a man named Peter Diamandis made a very interesting comment. He's the founder of the X Prize, and that's for excellence and genius. He said we have to have a massively transformative purpose. And that's what we have, a massively transformative mission to engineer and put together all the things that we're learning, really, which are becoming, I think, even more obvious during this COVID. The fact that so many people are alert, so many people are on their instruments, so many people are engaged, so many people are worried. I think the human consciousness has come together so that we will be able to figure this out. It's a very big project, it's a very big thing, but I think our life lesson is that we're taking a journey. We all are taking this journey from the moment we were born to the minute that we know that we face mortality. But there's mortality and there is morality. So we have to find a global ethic. We have to find the system, and we're looking at it. We're trying to figure it out, and we will, because if we can go to Mars, to the moon, we have the mental capacity and people's brains to figure this out. So we have to engage. We have to be a clarion call so that they hear us, so that they come to us. As I mentioned before, there's so many wonderful women, each one in their own capacity, magnificent, but there are those people, brainiacs, that have the ability to put all of this stuff together so that we can be servants of good. So that's what we're trying to do in our space. And that's what I advocate to these other NGOs. Try to find the organizations that are trying to put everyone collaboratively so we have critical mass, so that we can make this irresistible wall of determination to get the answers, to find the solutions, to press the corporations, to press the scientists, to press every different part of our society that could absolutely help in this vision.
Thank you so much, Barbara, and such a powerful message. Really it is. And it's so good to hear that from you, because I think, you know, the questions that the audience have asked, this is what they need to hear to either keep going or to contribute, or to put, you know, as you said, some of this, what they know they need to do, and they have the genius to do it, but put it to good use, and to put it now, not waste any more time, but to do it now. So thank you so much for that. For the final question, because I know that I'm very conscious of time, we've let this go on for long, but because you've had such powerful messages to really share with the people that I believe need to hear it and want to learn from the amazing speakers. But Rima, I want to close with you because one of the audience has asked, and I'm sure she'd love to hear the answer to this, but she would love to see you creating supportive change among Lebanese women. So if you were going to do that, how will you do it? How will you create this support chain? And it's very specific here to Lebanese women. I think they really need to be inspired by you, and they need to hear this message. What's your message to them?
First of all, supportive chain. This is a really cool question. A supportive chain would have to start by elevating and improving the way we support one another. I always say this, that us females, we're very strong individuals, but we need to support one another more. And being able to invest in female-owned businesses or female brand projects is a very important thing in ways to support one another. It could start with a simple thing such as a compliment, or as Barbara mentioned, social media, reposting, commenting, bringing awareness to someone or a female's project that she's trying to hopefully accomplish. This is something that will uplift our society as women. It will elevate and improve socially, culturally, and morally our deprived people, and it will exalt the emotionally or spiritually one another as females. And I think that we need to do everything it takes to thrive, exactly how it was mentioned in that video that you showed earlier. We need to really support one another. It starts simply by just every female supporting every female. And if we all join together as one, we're unstoppable, that's for sure.
Thank you so much, Rima, and it's so true. And I can't wait to see all of the speakers and the developments that they make in the space that they're in. It's really, really inspiring. And with that, I'd like to come to a close, because I believe now we've addressed the topic so comprehensively. We've looked at how your charitable organizations that you've been working for have managed to survive by being agile, by being nimble, by adjusting, repurposing, as Manna put it, by being focused and using not just social media, but digitalization, as Dr. Sultan and Nazreen talked about. Rima, you know, your continued inspiration and the message that you have for the women that are so inspired by you, and just to keep on going and to really start in your home. Dima, you know, amazing achievement so far to date. The MP, you know, being first of only a small number in Lebanon, and to learn about the work that you're doing with the charitable organization is really truly inspiring. And I believe that there were so many takeaway messages, so many powerful messages, like being transparent to the donors, the power of collaborations and connections, to keep on going, being consistent and persistent in your mission, in your message, and never giving up. Because as Barbara said, even one person, one day, you know, one impact it's the critical mass, it's the compound effect that is going to change the world and change the lives of everybody. And I really think that, I mean, we've still got participants here. We've gone way over time, but they're here to listen to the inspiration and amazing messages that all of you have shared with us today. So from the bottom of my heart, I'd really like to thank you, to encourage you to keep doing the amazing work that you're doing, and to rally and to lobby and to empower women to be on your journey, because you're going to make an amazing difference to the world. Thank you, Forbes, for hosting this. Most people during COVID wouldn't even think this is a topic worth speaking about, but Forbes took the time out to speak about this topic, to invite people to listen, to be impacted, to be inspired, and to ultimately make a difference. So thank you, everybody. Thank you, Forbes. We're at the close. I hope to see you again. Look forward to learning more about your futures, and good luck with all your endeavors. Thank you so much.
Thank you very much.
Thank you, everyone.
Kisses to all of you. Wonderful girls.
Yeah,
Wonderful ladies.
Beautiful world leaders.
Thank you, dear.
Thank you.
Thank you, Rima.
Thank you,
Rima is
Barbara.
an inspiration.
Thank you.
Oh, I
Wonderful.
love you.
Yeah,
Oh my
Rima.
God, Dima, I'm a fan. I'm a big fan, Dima. And Manna.
Wonderful ladies.
Thank you, everyone.
Thank you.
Thank you.
Shufkum
Amazing
Lebanon.
ladies, stay strong. Bye.
Yes, thank you for your work.
Thanks, Barbara.
Yes, thank you, dear. Thank you. Wonderful.